Now let's look at the prep position for the buccal surface of tooth number 22. You can use mostly the same setup as when prepping the incisal target area we saw earlier. For settings that are identical, I've displayed the text a bit darker in this manner. From now on, for positions that are slightly different, I will indicate them by highlighting the text in a brighter way. Now, when prepping the buccal surface, unlike the incisal, you need to turn the patient's head a little more to the right. This is more advantageous for securing a clear view of the buccal surface. Let's watch the entire prep process in the video. The green line in the image shows the distance between the patient's head and the operator's body. Keeping this as close as possible is advised. If you are close enough to the patient's head for your stomach to touch it, you can secure a clear view without bending your back forward or sticking your neck out like a turtle. To bring the operator's torso close, the legs will naturally spread out to both sides, and the foot pedal should be positioned to align with the tip of the right foot in this wide stance. For the operator's musculoskeletal comfort, the head should not be held in a forward turtle-like posture, nor should it be maintained with severe left or right rotation for prolonged periods. Keep your head positioned parallel with your shoulders, so as to minimize any twisting of your neck. If you as the operator realize that your neck is severely rotated or twisted, you should adjust the position of your neck or torso, which are the fundamental roots of your posture, to unravel the rotation and twisting. Let your elbows hang naturally and avoid flaring your underarms out too much. Now let's look at the prep position for the mesial of tooth 22. The posture is mostly the same as the buccal prep we saw earlier. As you can observe in this very moment, one of the most effective techniques is to gently elevate the obtrugate wing vertically with your left index and middle fingers, thereby preventing water spray from being directed towards the patient's nose. When you lift the wing with your left index and middle fingers, the water level in the patient's mouth can sometimes rise. In these instances, a practical tip is to adjust the suction level by delicately controlling the depth of the suction tip, almost as if you're just lightly pressing it. As you can observe, the water sprayed onto the nasal wing of the obtrugate forms dew-like droplets. Periodically suctioning this away, this meticulous and detailed action will naturally become intuitive and effortless with continued practice, eventually coming out smoothly. Let's take a look at the overall video. You press it down, raise the wing, and then press down again. Start. Let's look at the prep position for the distal of tooth 22. Compared to the mesial prep, the patient's head position is turned a little more to the right. The operator's neck, comparatively, exhibits a slight lateral flexion toward the left side. This will allow for a significantly improved view of the bucco-distal surface. Let's watch the overall prep video. Let's look at some key points throughout the process. In this instance, you can clearly observe that the suction tube is curved outwards, directing it away from the operator's body, rather than being bent inwards towards it. You have the option to either bend the suction tube inward, carefully positioning the suction tip at the maxillary tuberosity, or alternatively, bend it outward to precisely place the suction tip on the mandibular retromolar pad. The method of bending can be chosen based on what is most appropriate for each specific situation. In this particular case, to prevent water from splashing into the patient's nose, you would bend the obtrugate wing using the first and second fingers of your left hand. A bend directed away from the body is generally more suitable here. For example, if you bend it towards the body, if you were to bend it inward towards the body, for instance. For example, if you assume it's bent inward toward your body, the position of your left hand would be situated lower in relation to the oral cavity, thereby making the action of holding the obtrugate wing rather uncomfortable. This is a comparison of the posture for the mesial and distal of tooth number 22. It's nearly identical, but if you look at the arrow, you'll see slightly more lateral flexion in the operator's neck for the distal on the right compared to the mesial on the left. The skin area on the right side of the neck is slightly larger. If the patient's head position for the distal preparation had not been rotated a little more to the right, in contrast to the mesial, then the amount of left lateral flexion in the operator's neck would have increased further, which in turn would have been detrimental to the operator's neck health. This is the prep for the palatal surface of tooth number 22. In this case, unlike the previous ones, it's better to position your body perpendicular, not parallel, to the tooth axis of number 22. That is the meaning of the classification perpendicular in the title above. For tooth number 22, which is positioned perpendicular to its axis, there are two modes of approach, one from the left side and one from the right. Since tooth number 22 is situated in the upper left quadrant, an approach from the right side is more appropriate. This explains the significance of the capital R appended after perpendicular. Now let's look at it step by step. Since tooth number 22 must be approached perpendicularly from the right, the operator's body should be positioned at about 9:30, facing the patient's head. To secure a clear view of the palatal surface, the patient's head should be turned to the left. At this point, rather than a slight rotation, it's necessary to firmly ask the patient to turn their head completely to the left. Unlike the parallel approach, in this case, the space to spread your legs is blocked by the chair, so keep both legs neatly together. To achieve a direct view of the palatal area, slightly bend your waist to the right, and concurrently, perform a slight lateral flexion of your neck to the right. One of the key techniques here is to use your waist and neck together, so the muscle load is distributed between them. If you only bend at the waist or only flex your neck, you'll strain that single area more. The position for the two-handed rest is the same as in the previous slide. Let's watch the full video. As you can observe, when applying the handpiece burr to the palatal target area, a useful method involves using your left second finger to secondarily support the handpiece head. This action significantly enhances the overall stability of the handpiece's movement. The remaining details match the last slide. As you can see in the photo on the right, the angle of lateral flexion of the neck during a palatal preparation almost perfectly matches the angle of the headrest. Therefore, if the headrest is not fully reclined, the degree to which the neck is bent increases substantially, resulting in a significant rise in neck strain. As mentioned before, if you straighten your back completely, the angle at which you bend your neck will also increase. If you bend your back slightly to the right and also perform a slight lateral flexion of your neck to the right, the strain on your neck muscles will be reduced. As noted, if you completely straighten your back, your neck's bending angle increases. If you bend your back slightly to the right and also do a slight lateral flexion of your neck to the right, the strain on the neck muscles is reduced. The bending angle, shown by the green arrow in the right photo, is distributed between the back and the neck. Next, let's look at the difference in leg posture between the parallel and perpendicular alignment modes. On the left, when in parallel mode, you should spread your legs to minimize the distance between your body and the patient's head. The green circle indicates the position of the chair's foot pedal. On the right side is the perpendicular mode of alignment, where you gather your legs closely to minimize the distance between the operator's body and the patient's head. The green circle indicates the chair switch foot pedal's position.